Welcome everyone. Today's tutorial is all about erythema multiforme, Stevens-Johnson syndrome, and the toxic epidermal necrolysis, which are basically the same disease with different severity. Erythema multiforme. In almost 90% of the cases, it is associated with herpes simplex virus. In the erythema multiforme, there are the target lesions, which means that there is central ulcerated area surrounded by the pale edematous area and further surrounded by the reddish or the purplish area. It mostly involve the extensor surfaces, palm, sole, and the mucous membrane. Stevens-Johnson syndrome. Stevens-Johnson syndrome, it involves less than 10% of the body surface area in which there is a detachment of the various skin layers from each other. There are atypical targeted lesions in which instead of 3 layers there are only 2 distinctive layers. Toxic epidermal necrolysis, it involves greater than 30% of the body surface area. Mostly it involves the mucosal surfaces like the oral mucosa, respiratory tract, or the conjunctiva. Most of the time, the drugs are responsible for conditions like Stevens-Johnson syndrome and the toxic epidermal necrolysis. These drugs include the sulfonamides, NSAIDs, the allopurinol, and the anticonvulsants. In this picture, you can see a person with toxic epidermal necrolysis involving the trunk, the arms, and the forearms. The clinical features. The target lesion in the erythema multiforme, they are mostly on the hand and the feet. There are painful bullous, eruption and the target lesions on the hand and the feet. The person may have painful eating, swallowing, and difficulty in urination depending on the part of the body involved. In the Stevens-Johnson or the toxic epidermal necrolysis, the disease may get complicated by scarring the involved area, like in the eye conjunctiva. It may get complicated by scarring, which is an ophthalmological emergency. The diagnosis is mainly on the clinical basis, but can be confirmed by skin biopsy. Regarding the treatment of Stevens-Johnson syndrome, the first and the foremost thing is to stop the causing drug. The patient may need an intensive care unit. The patient needs well hydration because there is a disruption of the body surface area. The patient large amount of water get evaporated and the person would be dehydrated. Regarding the patient nutrition, an enormous amount of nutrition supplements have to be provided because there is negative nitrogen balance going on in the body as the skin surface has been interrupted, so there are high chances that the patient might get infected by the skin normal flora. So for that, the patient would be provided with the broad spectrum antibiotics. The specific treatment of Stevens-Johnson syndrome, it involves the corticosteroid, which may be given in 1 mg per kg per day. An alternative to the corticosteroid is immunoglobulins, which can be given 1 gram per kg per day for the 4 days. If the patient condition is not relieving with corticosteroids or the immunoglobulins, they should be stopped immediately. And the patient should be provided with cyclosporin or the tumor necrosis factor inhibitors. And apart from these treatments, etanercept has been noticed as an emerging therapy. Thank you all. Have a good day.